So we're going to talk next about how food travels from your mouth and pharynx down to your stomach through the esophagus. So we're going to start with the swallowing mechanism. So as you chew up your food and masticate it, mix it with the saliva, it forms a bolus, which is a mixture of food and saliva that the tongue pushes to the back of the pharynx and into the pharynx, and then once it enters the pharynx, the epiglottis is going to close, which is going to keep food from going down into the trachea, down into the lungs, and food is going to enter the esophagus. And when it enters the esophagus, it's going to cause peristalsis, or a wave of contractions to push the food from the top of the esophagus down to the stomach. Sometimes you get something in your stomach your body recognizes as being potentially harmful, and we have reverse peristalsis or regurgitation, which would push the food up the esophagus. So the esophagus is the tube that carries food from the pharynx down to the stomach. It's about 25 centimeters long. Like I said, it carries food from the pharynx to the stomach. At the bottom of the esophagus is a ring of muscle that closes off the opening to the stomach, called the lower esophageal sphincter, or sometimes called the cardiac sphincter. And so as the food enters the esophagus, it travels down the esophagus through peristalsis. And once it gets to the bottom, the esophageal sphincter is going to relax and open, allow food to enter the stomach, and then close again to keep the food and the acid and the enzymes from going back up into the esophagus. Now sometimes that sphincter isn't strong enough, or certain foods can cause problems where the food, the acid, and the enzyme go back up into the esophagus, and because there's no protective mucus in the esophagus, that can damage the lining of the esophagus. And when it happens occasionally, we call that heartburn, because the esophagus runs behind the heart, and so sometimes the pain feels like it's coming from the heart. In fact, sometimes severe heartburn can be confused with having a heart attack. Now sometimes people have a chronic problem with the esophagus and the esophageal sphincter and heartburn, and we call that GERD, or gastroesophageal reflux disease or disorder. And that's more serious. When you're having heartburn on a very regular basis, the wall of the esophagus can start to erode away, and you could actually get a hole in the esophagus. So a lot of times we'll treat that with acid reducing medicines and changes in the diet, and then sometimes they'll do surgery where they'll take some of the muscle wall of the stomach and wrap it around the esophageal sphincter to strengthen that sphincter to keep the food down in the stomach and keep the acid and the food and the enzymes from going back up into the esophagus.